Hello, everyone. My name is Daisy Garcia. My health topic is maternal mortality, birth outcome inequity in African American women. I do want to apologize in advance. I do have a cough, and I'm so sorry if I cough in between. So, maternal mortality, what is it? Maternal mortality is recognized as the death of women during pregnancy, delivery, and post delivery. The maternal mortality ratio varies across the world, with higher numbers of pregnancy-related deaths in lower-income countries. Roughly 94% of all maternal deaths can be seen throughout lower and middle-income countries. More than 800 women lost their lives to pregnancy complications and childbirth-related causes each day, with a total of more than 300,000 deaths in 2017. Most of the complications that occur before and after childbirth are preventable and can be treated. Approximately 75% of all maternal deaths are caused by bleeding, infection, high blood pressure, delivery complication, and unsafe abortion. Every year in the US, about 700 women die from pregnancy-related complications. More than 33% of maternal deaths are results of cardiovascular conditions. Black women are more than 3 times likely than white women to experience a pregnancy-related death. The pregnancy-related mortality ratio, PRMR, is the highest number of deaths per 100,000 live births. The average PRMR in the US is 17.2. However, the PRMR for non-Hispanic Black women is 43.5 as opposed to 12.7 for white women. The California Pregnancy Mortality Surveillance System, or California PMSS, reported over 1,900 deaths while pregnant and up to 1 year after pregnancy from 2008 to 2016. 31% of the total maternal deaths in California were in connection to the lack of continuum care during pregnancy. The PRMR in California ranged from 9.5 to 14.9 within the span of 8 years. Most of the pregnancy-related deaths, about 82%, occurred after pregnancy. The ratio for women living in low-income communities is more than doubled with a PRMR of 16.4. Racial disparities in California between 2014 to 2016 were reflected in the PRMR of 56.2 deaths for Black women, 6 times greater than white women and other racial groups combined. The Los Angeles County is divided in 8 service planning areas. The city of Palmdale, or SPA 1, is among one of the several cities located within Antelope Valley, or SPA 1. The population consists of approximately 46.1% white and 13.2% Black or African American residents. Although more than 90% of residents have health insurance, the health inequities and racial disparities in access to maternal care is limited for vulnerable populations. Even with health insurance, this may not reflect the unequal opportunities in accessing necessary care. Black babies in the county are more than 3 times likely to die than white babies. Evidence indicates that racial groups such as Black, Native Hawaiian, and American Indian residents will experience a higher rate of morbidity and mortality regardless of where they reside. The mortality rate in Los Angeles County was the highest among Black residents from 2012 to 2017. The mortality rate decreased in all the SPAs except for Antelope Valley. Palmdale is a relevant community to this health issue, and I chose to research it because of the city's high mortality rate. This makes Black women more susceptible to birth outcome inequity. The disparity among demographic groups is recognizable to the systemic racism that exists and directly impacts pregnancy-related deaths. By looking at mortality in the local community of Palmdale, trends among pregnancy-related mortality in non-Hispanic African Americans can be understood to reduce and prevent maternal death. So this graph is just showing the AAIMM, African American Infant and Maternal Mortality Organization, which I will mention in a few moments. Racial disparities in California between 2014 and 2016 were reflected in the increased PRMR of 56.2 deaths for Black women, 6 times greater than white women and other racial groups. Providers reflect implicit bias and associate positive attitudes towards white patients and negative attitudes towards racial and ethnic groups. Although maternal mortality rates are higher in some states than others, the pregnancy-related mortality ratio remains the highest for minority groups, with Black mothers experiencing the most discrimination in healthcare. Seen across the nation and within state and local communities, birth outcome inequity creates racial and ethnic gaps. Better quality of care during pregnancy, delivery, and close attention to care up to 1 year after childbirth can reduce pregnancy-related mortality. A study with almost 10,000 postpartum women revealed that non-Hispanic Black women, in comparison to white women, were less likely to receive an opioid prescription during discharge. Also, conditions such as postpartum depression, long-term impacts, increases the need for universal screening and more accessible programs. Screening in the early stages of disease is very important to promote health knowledge and awareness. Black women are also more likely to experience maternal morbidities such as complications from high rates of cesarean delivery and infection. Even with coverage from health insurance, only a small percentage of Black women are treated. Evidence shows that Black women who have the same access to health resources as white women still receive unequal and low quality care. Even with variations among sites of care, Black women are more than likely to experience disease, unfair treatment, and discrimination. So, current approaches and interventions. Public health efforts in reducing maternal mortality have most recently been proven successful on October 4th of this year, when the governor of California signed the SB 65 bill. This was created to improve maternal outcomes by deconstructing racism and racial bias throughout the state. With increased research and collection of data, the bill allows for evidence-based recommendations to reduce the rate of maternal death. It will provide doula services under Medi-Cal that provide support for women during pregnancy, delivery, and postpartum. Public health professionals have attempted to improve the racial and ethnic disparities in maternal health outcomes by focusing on quality of delivery. Health professionals also suggest making racial equity a priority throughout interventions by altering methods of research to include disparities in African American women. For example, the development of new coding procedures and methods with additional maternal mortality reports. Organizations such as the Black Infants and Families Los Angeles follow the African American Infant and Maternal Mortality Initiative. This organization or foundation builds a platform for public health officials from different departments to collaborate and reduce the high rates of infant and maternal deaths. SPAs, or service planning areas, with the highest African American infant mortality rates, such as Antelope Valley, have built relationships between members of the community to reduce the Black and white mortality gap by 30% in the year of 2023. A few strategies that this organization has pushed forward are community action teams, or CATs. These are CATs among Antelope Valley in the area of Palmdale that utilize primary prevention methods to promote local action and collaborative effort. Black Infant Health is also another organization that helps Black mothers maintain a happy and healthy life during pregnancy and after childbirth. So, future directions. These are just a few of the stakeholders that are able to aid in this current health issue. As data collection and research expands for maternal mortality, future policies to address racial disparities among African American women should include increased availability and access to quality healthcare and services, to avoid things such as waiting in long waiting lists or restrictions to applying to programs. The public health goal of increased access should engage collaboration between policymakers, the California Department of Public Health, and the Department of Healthcare Services to provide a higher amount of maternal health education and services. Maternal health research should also recognize racism and health inequity among target populations as key indicators when evaluating existing programs. Educational courses on implicit bias is also very important to acknowledge the health gap that is seen in maternal mortality. Public health media on maternal mortality, such as infographics, should also be located within more waiting rooms such as posters on physical health. This should be implemented in areas like healthcare facilities to really show and promote, bring awareness to the issue. Considering racial bias and quality care when examining healthcare access and coverage in state and city reports. This is very important because when considering racial bias in reports, it gives a true amount of results. Stakeholders such as the California Nurse Midwife Association and the National Health Law Program can work together to address the issue of maternal mortality with greater funding and cooperation. Organizations such as the World Health Organization and the United Nations Population Fund set 5 national health goals to be accomplished by 2025. I'm sorry. These objectives include more doctors' visits for pregnant women, increased care after delivery, reproductive health freedom, increased number of doctors' visits for pregnant women, increased presence of health professionals during childbirth, and greater proximity of emergency care centers. Minority communities across the nation continue to experience negative health and birth outcomes, but with collaborative work, current and future legislation, progress can be made to reduce maternal mortality rates and improve maternal health. Thank you.